All right, good morning, everyone. Again, thank you so much for joining our Using PSYCKES for Managed Care Plans PSYCKES training webinar. We're going to go ahead and get started since there's a lot to cover today. So just some housekeeping items before we begin the training. All phone lines have been muted to help prevent any background noise, but you can access the Q&A box in WebEx to ask your questions throughout today's webinar. So you can get to that Q&A box. It should be on the bottom right-hand corner of your screen. If you're not seeing it, there's 3 horizontal dots you can click, and then you should see the Q&A option there. So please just type your questions into the Q&A feature and submit to all panelists, which should be the default. We ask that you don't use the chat function since we won't be monitoring that. So just try to ask your questions using just the Q&A feature today. And then the slides and recording link will be emailed to all attendees after the webinar, and both the slides and recording will also be posted to our PSYCKES public website. So here's our agenda. We have a brief PSYCKES overview about what PSYCKES is, what data is included, what population is included in PSYCKES. Then we have plan level quality improvement within MyQI report. So we'll be looking at some measures, one measure in particular, and going through the flow of MyQI report, and also looking at the MyQI report race and ethnicity view as well. We have population health management with recipient search. So here we can look at different filters and reports you can run within the recipient search screen. We have reviewing member level details within the clinical summary. So we'll just check on a few different sections within the clinical summary that might be important to some of the work that you do. And then we want your feedback. So we do have a polling feature that we want to use later on in the webinar just to get some feedback on, what would be helpful to improve within the PSYCKES application, what new features would you like to see, are there any new data sources that you'd like to be added? So that should be a fun little way to end the webinar. And then we have training and technical support. And we'll make sure to stop at the end to answer any questions that come up. All right, so we'll go into our PSYCKES overview. So PSYCKES is a secure web-based HIPAA-compliant application, and it integrates multiple data sources to help support population health, quality improvement, care coordination, and clinical decision-making. So what PSYCKES does is it takes over 10 different data sources. Our biggest one is Medicaid, but we also have data coming to us from other state administrative databases. So we have EMR data coming from state PCs. We have New York City data, which includes Rikers, DHS, Department of Homeless Services, DOHMH data, and more. We also have state OMH data, so that includes things like AOT, suicide incidents from NIMERS, CARES data on high-intensity outpatient and residential mental health services. We have information coming from DOH MAP on health home and care management enrollment. And then we also have provider and recipient entered data. So that includes psychiatric advance directives, safety plans, relapse prevention plans, discharge plans. Basically, you have the ability to upload any type of documentation into a member's clinical summary that's relevant to their care. And then we have rating scales. So that includes the suicide screening, which is the CSSRS, and the depression screening as well. So that's data that can be entered into the application. And right now we have over 12 million individuals who are viewable in PSYCKES, and that includes any individuals with any history of Medicaid-funded behavioral health diagnoses or treatment, or if they've had state PC, inpatient or outpatient services, or if their health home enrolled or in outreach. So we have a few different reports available in PSYCKES. Our first one is the individual client level reports. So this is our clinical summary, and it takes that Medicaid data and that other state administrative data feeding into the application, and it puts it into a user-friendly format. So you can see up to 5 years and beyond in some cases for individuals. You can see up to 5 years and more worth of data in their clinical summary. We also have MCO and provider level reports. So we have my QI report. We'll be going over that today. So that looks at the current performance for your plan on all quality indicators. So you can drill into a quality indicator and review the names of clients who meet criteria for that flag. You have the ability to filter, etc. We'll also be looking at recipient search. So this is where you can run ad hoc reports to help identify any cohorts of interest. And we also have our advanced views on the recipient search results page. So we'll be going over an example of one of our advanced views today. And then we have usage reports. So that's really used to monitor PHI access by staff, protected health information access. And then utilization reports helps to support provider value-based payment data needs. And then our last big report is our statewide reports. So that's where you can select a quality indicator and help and review your by statewide proportions. You can review by population, such as complex needs. You can review by provider location, region and county, or client residence, region and county. You can review by plan, network, provider, etc. And the last part of the PSYCKES overview I want to go over is our quality indicators, otherwise known as our quality flags. So PSYCKES identifies clients flagged for quality concerns to help inform the treating provider or the care coordinator or the managed care plan to really help support that clinical review and quality improvement. So we have, I think, over 80 flags at this point in PSYCKES. So just a couple of examples here. We have health home related flags. So examples of these would be folks that are eligible for Health Home Plus but haven't received a Health Home Plus service. We have medication related flags, such as folks who are on multiple antipsychotics or multiple antidepressants, or maybe those who haven't adhered to their medications. We have acute care utilization. So this looks at folks who have high utilization of hospital services or have been cycling in and out of hospitals with those readmission measures. We have general medical quality flags in the application. A couple examples of this would be no diabetes screening on with schizophrenia or bipolar on an antipsychotic, or no outpatient medical visit in the past year. And then we have our performance tracking measures. So these are the Department of Health run quality indicators that we display in PSYCKES. They are run with an intentional 6 or more month data lag in the application to allow for complete data to come in. So I'll explain more about that when we get to the MyQI report section next, but just some examples of the performance tracking measures include no follow-up after mental health inpatient within 7 or 30 days, no engagement after mental health inpatient, and then no intensive care management after mental health ED or inpatient visit. So again, those are just some examples of the many flags we have in PSYCKES. So we're going to jump right into MyQI report. Now, MyQI report is a tool for helping to manage your quality improvement efforts, and it is updated on a monthly basis. So the data that's included in MyQI report includes the eligible population, which is otherwise known as the denominator. And for you guys as plans, this would be members or events or episodes, plus any other parameters, depending on that quality indicator specifications. Then we have the number with QI flag, which is also known as the numerator. So this would be members or events or episodes that meet criteria for that specific flag. So then we take the numerator over the denominator and create a prevalence rate for your plan. And what you can do is compare that prevalence rate for your plan against the statewide prevalence rate. You also have the ability to filter your QI report by program type, by product line or age, by population, client residence, or provider location, region, or county. Or you can drill down to a list of members who meet criteria for that flag that you've selected. And our QI reports can be exported to Excel and PDF. Now, just a slide on understanding MyQI reports. So when clients or members are attributed to your MCO's QI reports, they're attributed automatically based on their current enrollment or recent disenrollment in your plan. So that's used to automatically link members to your plan's QI report so that current members are included each month with our monthly refresh for our MyQI report screen. And then we have the period of observation for the specific quality indicators. So these are assessed by measure, and it's important to note they vary by each measure. So for example, the period of observation for our high utilization quality indicators is the past 13 months. But for other measures, it might be the past 12 months, or have other specifications that you'd want to just double check when you're looking at why somebody meets criteria for a specific flag. And then QI report trends over time. This report's available to help show the prevalence rates of quality flags by provider over time, over the past year. All right, so I'm logged in as ABC Health Plan, and you can see on the top left, I have navigated to my QI report. So this is the screen that you'll land on. We've highlighted here quality improvement, that little tab on the top left, quality improvement as of 2/1/2026. So these are our PSYCKES run measures. They're run on a more real-time basis compared to our DOH measures. So that as of date will update on a monthly basis. So right now we're as of 2/1/2026. And you land on the indicator set page. So if you look down, you can see that we have the indicator set name listed here that you can drill further into. We have the population that's included within that indicator set. Then we have the eligible population or episode. So some measures are based on eligible populations or individuals, and then other measures are based on eligible episodes like inpatient discharges. Then we have number with QI flag, and that looks at who meets criteria or what episode meets criteria for that specific quality indicator. And then we have the percentage here. So this should be green, but this is basically a percentage for your plan to see the number with QI flag over the eligible population or episode, and that creates your prevalence rate. So the green one is your plan's prevalence rate, and you can compare that against the blue, which is your statewide prevalence rate. Now we have hovered over the performance tracking indicator set tab. So here, these are our DOH run measures. They are run with an intentional lag of 6 or more months to allow for complete data. As you can see, the as of date is a bit longer than 6 months ago. So it is taking a little bit of time to update these in the application, but we do expect this as of date to be more recent within the next couple of months. I know DOH was doing some testing on their indicators. So a little bit more of a lag here, but hopefully that should be updated within the next month or two. But just something to keep in mind between these two tabs is the different as of dates, and this one has an intentional lag for those DOH run measures. So what you can do here is you can apply a filter to your plan's QI report, and that can help narrow down the population that you'd like to view. So if we click on that filters button on the top right, the filter pop-up will appear. So here again, you can filter by program type, the managed care product line, age group, population. So you can even filter by those who are complex needs, client residence, or provider location. So in this example, we are going to filter by the HARP product line. So now that we applied our filter, you can see it right up here on the top. Our numbers have changed throughout the MyQI report screen to account for that HARP restriction that we put on. So what I'm going to do now is drill into an indicator set, and I'm going to drill into specifically the mental health performance tracking measure set here. So when I drill into that, you can see a list of indicators come up that exist within that mental health performance tracking measure set. What I'm going to talk about here, I'm going to look at one one quality indicator in particular because we are in the midst of a HARP performance improvement project. So I know some plans on the line are participating in that HARP PIP, so I want to focus on this quality indicator. But the steps I'm going through can really apply to any indicators that you're working with in MyQI report. So for this indicator in particular, no engagement after mental health inpatient, it looks at the percentage of individuals who are ages 6 to 64 years old identified as having an acute inpatient discharge with a primary diagnosis of mental health or intentional self-harm, who did not receive 5 or more follow-up visits with a community-based mental health provider within 90 days of their discharge. So this includes services like ACT, PROS, a visit to an OMH licensed clinic, etc. So that's that indicator's definition. And what we're doing now with this indicator is it's actually looking at the mental health inpatient discharges or episodes. So I think it's important to kind of read through this row here to fully understand what this measure is capturing. So we have the population here, 6 to 64 years old, the eligible population / episodes. So this is looking at the number of eligible episodes, meaning eligible mental health inpatient discharges. So there's been 279 mental health inpatient discharges that have occurred for folks within that HARP product line. And within those discharges that we see for mental health inpatient discharges, 111 of those did not receive 5 or more follow-ups with a community-based mental health provider. So with that, our number with QI flag is divided by the eligible episodes, and now we have our plan's prevalence rate for this measure in particular. So when we compare it to the statewide prevalence rate, we are lower than the statewide rate, which is good news. We want to be lower. The lower our number, our prevalence rate is, the better. So if you notice for your plan that your plan's prevalence rate is above the statewide prevalence rate, that might be an indication where there's some room for improvement. So what we're going to do is actually talk a little bit more about this measure. I just want to go over the as of date and the intake period and then the follow-up period for this specific measure. So the as of date for the no engagement measure is run with an intentional 6-month data lag. So the as of date for the engagement measure will be 6 months prior to the PSYCKES run date. So what that means is 6 months prior to our PSYCKES run date, 2/1/2026. Now, the intake period for this measure is a 12-month intake period, and this ends 3 months prior to our new as of date. And I'll make sure to explain, in one sentence what this looks like with our current dates that we have in the application. Then the follow-up period is a 3-month follow-up period. So that 3-month follow-up period occurs between the end of the intake period and the as of date to allow for those 5 or more community-based mental health care provider follow-ups. So with that, what we have for no engagement right now, we have our PSYCKES run date of 2/1/2026. So the as of date for this measure will be 6 months prior to 2/1/2026. So that lands us on August 1st, 2025. Now, the 12-month intake period will end 3 months prior to the as of date. So 3 months prior to 8/1/2025 is 5/1/2025. So we're looking back a year from 5/1/2025 for the intake period for this measure. And then that gap between 5/1/2025 with the intake period to 8/1/2025, the as of date, that's that 3-month follow-up period where we're looking to see if any of those eligible episodes have had 5 or more follow-up visits. All right, so that's the EIC no engagement measure in particular. Again, for any of the measures that you're seeing in the quality QI report, it's just important to look at those technical specifications. So that was the specifications for this particular measure. But if you're interested in seeing the specs for another measure, please feel free to reach out to us so we can provide those to you. All right, so we have drilled into that particular no engagement measure, and now since I'm logged in as a plan, I can see the providers that are serving members within my plan that are meeting criteria for this quality indicator. So I have the list of provider names on the left, the county that the provider resides in, the eligible population or episodes, so eligible episodes for this measure that meet criteria for this flag. The number of eligible episodes that are meeting criteria for this flag is 62 for the highest number we have in this column. And then we have our prevalence rate on the far right. So you can actually sort by these column headers. Right now we're sorted by number with QI flag. So again, that highest number is at the top, 62, but you have the option to sort by any other column that you'd prefer. So if we drill into Main Street Hospital, one of our plan providers, we can see the recipients tab. So here we can see for the no engagement measure, we have our HARP product line. We're restricted to our HARP product line up here, and then we're drilled into the no engagement measure here. And these are the recipients meeting that criteria for that no engagement after mental health patient inpatient quality indicator. So right now, this data, since it's protected health information, is scrambled for this training, but you would see the recipient's name, their Medicaid ID, and their date of birth. You can view their race and ethnicity, and then you can view any other quality flags that they meet criteria for, if any. So what you can do here is drill into a clinical summary. You have the availability to access clinical summaries for members currently enrolled in your plan or recently disenrolled, or you can export to PDF or Excel here. One other thing you can do is actually change the view in your QI report to race and ethnicity. So on the upper right-hand corner, we have a view drop-down, and the race and ethnicity view, when selected, is applied to both the indicator set and indicator tabs. So that will display the measure performance for each population group. So we've applied that race and ethnicity view here, and here's our no engagement after mental health inpatient measure on the top. So you can see you have the population again, which is the age group included for that indicator. Then you have the total, and then it's broken out by each race and ethnicity group on the right-hand side. Now, what you can do is you can actually hover over this bar chart on the right-hand side and see the measures numerator and denominator for that specific race or ethnicity. So you can see here, Black has 49 for the numerator and 101 for the denominator, and that's turned into their prevalence rate, which you can see in the corresponding column for that race or ethnicity. So what you can do here is you can drill further in again to that recipients tab, or you can actually export this to Excel to or PDF to just play around with this report a little bit more if you'd like to view the specific numerator and denominators for each race and ethnicity. Okay, we're going to go into recipient search now. And what we have here in recipient search are members. They're linked to your recipient search view if they're currently enrolled or recently disenrolled in your plan. And disenrolled means this calendar year through April of the following year. So what you can do in recipient search is you can either look up an individual client or you can generate a list of clients meeting specific criteria that you've selected for your search. So we have some examples of recipient search filters in the application. So we have high need, high risk individuals. So here you can search for folks who are eligible for Health Home Plus, or folks who are having a higher Medicaid inpatient ER cost, or folks who are on AOT. We also have a complex needs population filter. If folks are experiencing homelessness or have experienced homelessness, we have a filter option for that. We have an alert section, and that includes suicide attempt information, ideations, opioid overdoses, etc. And then we have service settings. So you can search for service settings by a specific provider or by any provider, and that will show you, for example, who has received health home services or care management services, who has had ACT services, Health Home Plus, and more. So when you run a recipient search report, you can drill into a clinical summary. You can, of course, export your results to PDF or Excel. And then we have our advanced views. So I'll be showing an example of the outpatient provider's advanced view today, but there's also care coordination, high need, high risk, and hospital utilization advanced views. So let's jump right into recipient search. So on the purple navigation bar at the top, I've selected the recipient search tab, and here is what I'm seeing. I have the individual search at the top, so that includes the recipient identifier section. So here I can search for a member of my plan by their Medicaid ID, their social security number, or their name and date of birth. And then everything below that allows me to run a group search. So I'll be going through each section of the recipient search screen, but this slide was really just to show you where you can do an individual search versus where the group search sections are included. All right, so the first section is the characteristics section. Here you can search by age, gender, race, ethnicity, region, or county. So something cool here is the race filter. You can multi-select, and just want to show you here what it looks like when it is multi-selected. It creates an OR logic. So in this example, I'm looking for individuals who are Asian or Black or white. And I think you can select up to 4 races in this dropdown. Then we have our special population section. We'll actually be going through a few different drop downs here. So our first one is the population drop down. So we have OPWDD services eligible filters here for RE95. You can also even search for members in your plan that have had any OMH outpatient mental specialty mental health services in the past year. So this includes folks who have had ACT, CCBHC, clinic, day treatment, HCBS, PROS, any of those specialty OMH mental health services. That's all included in that one filter option instead of having to select each, OMH mental specialty mental health service that you're interested in the service settings. We have one filter option here that includes all of them. We have behavioral health high need, dual filters, high mental health need, and more. So let me go to our next drop down, which is the high need population. And this drop down has probably a few different filters you might find of interest to you in the work you do. So we have core eligibility highlighted at the top. Here you can also see if somebody has had high Medicaid inpatient or ER costs. So you can filter based on the top 1% or the top 5%. We have on track early psychosis program filters here, OPWDD New York Start eligible. If somebody's had IMT in the past year, that's a filter option here as well. Health Home Plus eligible. If somebody is Health Home Plus eligible according to our PSYCKES algorithm, this is where you can search for that group of Health Home Plus eligible individuals that your plan has currently enrolled. Then we have the alerts drop down. So at the top, you can select to search by any alert, or you can select to search by one specific alert in particular. So we have suicide attempt and ideations, self-harm, overdose alerts, and then OMH unsuccessful discharge. Now our homelessness alerts drop down, this is similar to the race drop down where it's a multi-select feature. So our homelessness alerts are based off of DHS, Department of Homeless Services for New York City. And then also we have Medicaid billing feeding into our homelessness data as well. So here you can search using either of those sources at the top, or you can search just based on DHS data or just based on Medicaid data from our Z codes. So you can select up to 4 different homelessness alerts per search here. And then the last filter in the special population section I want to show is the complex needs filter dropdown. So another multi-select dropdown, which is great because there's so many different complex needs criteria you can select from. At the top, you can search for individuals who have had any of these complex needs criteria, or you can select up to 4 specific criteria from the list below. Oh, and just a reminder, if you do multi-select, it will create that OR logic in the application. So in this example, we're looking for people who have had AOT or IMT or 3 or more inpatient mental health visits or 4 or more ER mental health visits. So it's an OR logic rather than an AND logic. And then our social determinants of health section, these are based on Medicaid billing, and they are separated out by domains, and you can actually expand the domain by clicking on that little plus sign. to see the different SDOH conditions that live within that domain. So you can select up to 4 SDOH conditions or domains at once, and then you can see your selections on the right-hand side of this screen when you make those in the SDOH section. Now, the managed care plan and Medicaid section in the recipient search screen. So this is going to auto-populate your managed care plan name at the top. And then you can filter by managed care product line. We have managed care enrollment here as well. So the arrow should actually be pointing to that dropdown since that's the one we have open. But this defaults to your current enrollees. And what we've seen before is sometimes folks are searching for individuals who are in their plan or have recently been in their plan, and they're not finding them on the results page. So it's important when you do search for an individual using a recipient identifier that you, if you're not seeing them on the results page, you want to make sure you can update this managed care enrollment dropdown to currently and recently disenrolled to see if they're captured in that recently disenrolled bucket. So here's where you can filter for enrollment, Medicaid enrollment status, any Medicaid restrictions. We also have the HARP status filter here, and that's been opened up just for the screenshot. And again, that's based on our HARP PIP participants. So this is where you can filter by HARP status, children's waiver status, and HARP HCBS assessment status and results. And then our quality flag section, this is where you can find a multitude of quality flags that exist in the application. I think, again, over 80 of them exist here. The no engagement and no intensive care management flags have been highlighted, but you can actually hit your control key and select up to 4 different quality flags per search. It's important to note at the top the quality flag as of date. That's just the most recent date these have been refreshed. And to the right, we have a definitions hyperlink. So if you click on that, you can actually export the quality flag definitions PDF. And that just can be something useful to save on your computer and reference later if you ever have any questions about the definition of any of these quality flags that we have in the application. All right, services by any provider. So this is an example of us expanding the outpatient mental health bucket of service settings, and you can see some of those specialty OMH services here. And this section is really just to identify any members that are receiving any of these specific services from any agency within the state that's providing that service. So you can see, for example, any of your plan members that are receiving ACT or CCBHC services throughout the state. And then here I wanted to just point out a way to search for folks that could be considered high utilizers by using that service utilization dropdown in conjunction with the number of visits dropdown. So here with the service utilization dropdown, you can open that up and select by clinic, ER, or inpatient services. And then you can select the number of visits. So if you want to see who's had any ER service in the past year, 10 or more times. They visited the ER 10 or more times in the past year for behavioral health, mental health, or medical services. That's one way to search for your high utilizers using the services by any provider section. All right, so we ran an example search here. So again, I'm logged in as ABC Health Plan. I'm defaulted to my current enrollees, and I've selected any OMH outpatient specialty mental health services as my service setting. So what I want to do here is, or what I can do is I can drill into a plan or a member's clinical summary. I can review the list of who actually meets criteria and has had any OMH outpatient specialty mental health services in the past year. I can export this list to PDF or Excel, or I can actually change to one of those advanced views I was talking about earlier in the top right-hand corner of the results page. So if I click on the little eye icon next to view, that will actually bring up pop-up up on my screen to show me what additional columns will be displayed based on the advanced view that I select. So again, we have our standard view, which is what you just saw, but we have a care coordination view, which adds on a number of different columns to that standard view. We have high need, high risk, hospital utilization, and outpatient providers. So in this example, I'm going to click on outpatient providers as the advanced view I want to toggle on. So as you can see, we have more columns now available to us on the right-hand side of the screen. So now I can see for these individuals in my plan that have had any OMH outpatient specialty mental health services in the past year, I can see, okay, have they had a primary care physician assigned by the plan? I can see the name of that PCP, I can see the most recent service with them, and then the number of visits with that assigned PCP in the past year. If I scroll to the right, I can also see mental health outpatient providers. So I can see the most recent mental health outpatient provider facility name, the most recent service in the past year, and then the total number of services with that provider. Now I have medical outpatient provider information as well as substance use outpatient provider information. So I can see the provider facility name, the most recent service, and the number of services with that provider in the past year. And if I keep scrolling to the right using that bottom scroll bar, I can also see the core or adult HCBS service provider information. So if any of these individuals on my results page have had core or HCBS adult services, I can see the provider name, what type of core service that they've had, the most recent service in the past year, and then the total number of services for that core or HCBS service in the past year. So you can export this, any of the advanced views to Excel as well. All right, I'm going to go on to the clinical summary now. So this is the client level report that you have available to you in PSYCKES for members in your currently or recently disenrolled in your plan. So the clinical summary summarizes up to 5 years worth of treatment history for a client. So it takes that Medicaid billing information and information from other state PCs, and it forms an integrated view for you to easily review detailed episodes of care and dates of service. And it's sorted similar to an EMR. So some of the data that's filing into the clinical summary would be that Medicaid billing information, state PC data, health home information from MAP, and care management information from MAP, suicide risk information from NIMERS, AOT information, homelessness data, and more. And you have the ability to export the clinical summary to PDF and Excel. So here's the list of the sections in the clinical summary. I won't go over all of these. We'll be touching on a few of them today in the next few slides. But as you can see, there's plenty of information available in the clinical summary for specific members in your plan. So here we have drilled into a clinical summary. And again, this data is scrambled because we're doing a training, but at the top, you'd be able to see that member's name. Underneath that, you can see the as of date. So our client level or member level clinical summary is updated on a weekly basis. So this is updated quite frequently. You have also a data sources hyperlink next to the as of date. So that'll show you if you ever need a reminder of what data is being applied to the client level clinical summary. We have that data sources option you can click on and then even export to PDF. So we've landed on the brief overview, which is like a short snapshot screen of an individual's more recent services. So we have at the top the general section. So here you can see they're part of Health First Managed Care Plan. They don't have a managed care plan assigned primary care physician. You can see they're not enrolled in Medicare. On the top right, you can see their HERP status if they have one. And then if they have a Medicaid eligibility expiration date, it'll show you that as well. Now below the general section, we have the current care coordination section, and this is current care coordination services that this person has received in the past year. So some examples of what can show here is if they've been involved in AOT, if they have health home enrollment or outreach. And you can see we have the health home name, the begin and end dates, the status, and then also the member referral number and the care management name as well. If they've been involved in ACT, housing residential program information, and then also things like homelessness information as well can show in the current care coordination section. And below that, we have notifications. So these are more of eligibility messages for certain services or notifications on things like complex needs. If they're meeting any of the complex needs criteria, you can see for the specific individual what exact complex needs criteria that they're meeting. If they're eligible for Health Home Plus, here I can see why. And this person has had 4 or more ER mental health inpatient or mental health stays in the past 13 months. They've been discharged from ACT in the past 12 months and then have an active AOT court order. High mental health need information is included in the notification section and core eligibility for this individual. There's other types of notifications that they can have, like prescription prior authorization, and then also eligibility for other services as well. And if their Medicaid is expiring, or if they have limited data because they're on Medicare. Those are just some other examples of notifications that can show here. And then below that, we have the alert section. So this is all available data. So if a suicide attempt or overdose or suicidal ideation occurred, beyond that 5-year look back period that we have in the clinical summary, this will still show in the alert section because it's such important data. So here you can see the alert, the number of alerts, the alert type, the most recent date, and where that alert was billed for or noted in the NIMERS database. Social determinants of health is also included in the brief overview and full summary views. And if you scroll down on the brief overview screen, I just want to point out the quality flag section. So here you can see the current quality flags that somebody meets criteria for. This is where the no engagement after mental health inpatient quality flag would live, among others that that person meets. And then we have diagnoses in the past year on the right of that. So that's broken up by behavioral health and medical diagnoses. Medications in the past year is underneath that. And then lastly, we have outpatient providers in the past year. So this is where you can see if in the past year have they had ACT services or clinic services or core or HCBS or PROS services. That would show here. It's just restricted to the past year. And then on the right, we have the all hospital and crisis utilization section. So that expands a bit further back to the past 5 years, and that's broken up by ER visits, inpatient admissions, and crisis services. So you can see the number of visits, admissions, or services, the type, and the number of providers that have provided that service, and then their most recent service and where. And at the bottom, we also have the ability to see if somebody has added a safety plan to that client or member's clinical summary, that would show on the bottom of the brief overview. So what I'm going to do now is actually drill into the full summary since you can see more details in this view of the clinical summary. So in the full summary, I'm not going to go over these sections again because I just went over them, but what you can do is actually scroll down and go to the alert section. So here you can see a bit more information on the alerts that this person has had. So you can see the alert type, the number of events, or positive screens, the first date of that alert, and then the most recent date, the provider that noted that alert in billing or in the NIMERS database, the program name, and then the severity, diagnosis, or results for that alert type. So if you drill in further, you can actually see, in addition to what you're seeing on the main clinical summary screen in the drill in, you can also see the medical classification and the source of that information. So this self-inflicted harm alert type is coming from Medicaid billing. Now, if you scroll down, you can also see this person's social determinants of health if they have any. What's nice about this section is that you can actually click on the SDOH condition where you couldn't do that in the brief overview, but you can click on it in the full summary view and actually see where those services provided were for these selected social determinant of health conditions. So I can see when I drill into sheltered homelessness, I can see the date of service of that SDOH condition, the service type and subtype, the provider name, since these are coming from Medicaid billing Z codes, and then the primary, secondary, and any other related diagnoses to that specific service. So I can see here's where sheltered homelessness was used for the bill, but other types of diagnoses were included on that same claim. Then we have quality flags. So again, this is where you can find if somebody meets criteria for the no engagement after mental health inpatient quality flag. You can actually click on the top right and change this to a graph or table view to see how often a person has met criteria for that specific flag. Did they just start meeting criteria for it? Have they been flagged with this indicator for the past few months? So it's a good way to see how long somebody has met criteria by looking at this in a graph view. And then you can also click on definitions here. Again, you can export these definitions to PDF, or you can even click right on a quality indicator that's highlighted to see that specific indicator's definitions. All right, diagnoses. Here you can select based on behavioral health and medical diagnoses, a specific diagnosis. So in this example, we've drilled into schizoaffective and we can see that date of service, service type and subtype, provider name, and any other diagnoses given with that specific service. So I've drilled into schizoaffective. I can see there was a recent date of service for that in the inpatient setting. And I can see there was a couple of other diagnoses that went along with that bill. All right, the IVOS section is just a helpful way to see any treatment patterns and an individual's history with services in just a visual graph view. So it's just a helpful way to see, if there's been a break in medications, did they end up in the ER, in the inpatient unit? Have they been consistently enrolled in AOT services or ACT services? So it's just a helpful way to visualize what's been going on in the past 5 years for that person. You can also toggle this to a table view to see the specific dates of service, the service type, and diagnoses related to that service. And one other thing you can do here is actually hover over the line or the dots on the graph to see the date of service associated with that line or dot. All right, care coordination historical. So at the top of the clinical summary, we have current care coordination, which is any care coordination services that somebody has received in the past year. But if you scroll down and land on this care coordination section, this is the historical view to see what types of care coordination services someone has received in the past 5 years. So you can see this person has had currently is an ACT. They've had AOT, they've had ACT previously as well. And then they've had health home services as well as health home plus. So you can see the service type, the provider, the first and last dates billed, and the total number of bills. If you drill in, you can also see practitioner information if it's available for that specific care coordination service. And then just some other examples of what could be included here is New York City jail-based care, which is CHS, intensive mobile treatment services, and even if they've had, health home outreach services, something like that would show here as well. Then behavioral health services. This shows you the service type for that specific behavioral health service, the provider that provided that service, the first date and last dates billed, the number of visits for that specific service, the most recent primary diagnosis, and the most recent procedures. So if you drill into either the details to see all of these services in a little bit more detail, you can see actually additional diagnoses that were given for that specific service, since just the main screen just includes that primary diagnosis that you're seeing. And then we have the option to toggle to a graph view to see, how consistently somebody's been receiving services. Our crisis services section, very similar to the behavioral health services section. We have the service type. So in this example, this person has received mobile crisis, both telehealth and mobile crisis response. They've had mobile crisis follow-up and even a stay at a crisis stabilization center. So you can see the provider name, admission or first date billed, discharge or last date billed, the number of visits or length of stay, and again, the most recent primary diagnosis and most recent procedures. And then hospital ER services. So here you can see very similar to the last two sections, the service type. So if they've had an inpatient stay or an ER stay based on substance use, mental health, medical reasons, you can see the provider, the admission and discharge dates, the length of stay, the most recent primary diagnosis, and again, the most recent procedures. So if you want to see any additional diagnoses that were given for that service, you would just have to drill in to the details option either here at the top or for that specific service row. All right, so what I would like to do now is switch to um, our polling section of the webinar. So let me just pull up my handy dandy Slido and enter in the first question. And let me also explain to you what's about to happen. So we are going to just ask a short series of 3 polling questions to help gather your feedback about any enhancements you'd like to see in PSYCKES. So to participate in the poll, there should be, let me launch one of my questions. Um, there should be the Slido app showing on the bottom right-hand corner of your WebEx screen, and it looks just like this. Um, there's a little screenshot on here of what the app looks like. And then once the question is launched, which it just was, you should see that question appear when you open the Slido app, and it should have an option to type in your answer to the question. So please feel free to submit more than one suggestion. If you could be as specific as possible, like with the first question, let me go to that, which is, would you like to see any enhancements added to recipient search? So just some examples would be, are there any new filters that you'd like to use in recipient search that don't already exist in there, like population filters or demographic or social need options? Are there any new service settings that you need to use in the work that you do that aren't already included in the recipient search screen, like critical time intervention or enhanced step down? If there's anything that would we could add to recipient search that would help you really narrow down the population that you need to focus on. We'd love to hear about it. So if you could just, I'll give it a few seconds for folks to add in their polling answers for would you like to see any enhancements added to recipient search? I see a few answers coming in. Historical housing information, um, tracking and monitoring in PSYCKES, my own report for members. This is great feedback so far. Um, and we really appreciate you taking the time to just let us know if there's anything at all you can think of that would be helpful to add to recipient search. I'll give it another 5-10 seconds, and then I'm gonna go on to the next question just for the sake of time. I'm seeing more suggestions for housing data and housing enhancements for recipient search. All right, I'm going to stop this poll and start the other one. If you have thoughts and you didn't get to answer this poll, we have instructions on how to add feedback after the webinar. So don't think this is your only opportunity to let us know what you would like to see in recipient search. So I'm going to deactivate this. Thank you all for your answers so far. I'm going to launch our next question, which is, Are there any additional data sources that you'd like to see added to Psyches? So I've just launched that question. Some examples we've heard of in the past were data related to cost, OTDA information, which is like temporary assistance benefits for folks. Are there any other data sources that you'd like to see in the application that we don't already have? And I know we already have a lot of data sources, so I know there's not a ton of answers coming in, so I'm hoping that's because we have most things you need already. Um, but, anything that you can think of that we don't have, again, we'd love to hear about it. Medicare information, that's a big one. We are already very interested in getting Medicare data, so you're not alone in your thoughts there. Um, it's a little bit of a process, but we are always working towards gaining the Medicare information in the application. All right, for the sake of time, I'm going to deactivate this poll, and we have one more question for everyone. So let me go back. Let me go to my next question here. And that is, would you like to see any functionality updates within the Psyches application? Um, and that includes things like, let me launch that question. Things that we thought of were, having more multi-select capabilities, like some of those filters, like the race filter, the homelessness filter, the complex needs filters, those all have the option to multi-select within that filter, creating an OR logic. So that was one of our thoughts. If you'd like to see more of those, if you could mention, which filters would be most helpful to have that capability on, that would be wonderful. Any additional look back periods that you would need in the application. Right now, we default a lot of our filters to the past year, but we do have other look back periods available, like for example, the year, the past 2 years, the past 3 years, 2022, 2023. So any functionality updates, getting some great answers in, more time frame filters, more and logic options, especially in the quality flags. Insurance eligibility lookup functions. Okay, multi-select within housing, SMI, and ER visits. This is very helpful so far. All right, what I'm going to do is I'm going to actually leave that open. But if you're interested in adding any additional features to Psyches, this isn't your only chance to let us know. You can also reach out to us at psyches-help@omh.ny.gov, and you could include a description of the feature you'd like to be added. The more detailed you are, the better. The purpose that that new feature would serve, and how this new feature could be helpful for a larger group of users, since we have, I think, over 26,000 people using the application right now. We'd love to hear how it could affect, more than just a small group of people. So that's how you can enter in requests in the future if you think of anything after this webinar. And then we have training and technical support here. So for more Psyches resources, we have our website, psyches.org, which has webinars, user guides, and more available to you. And then if you have any questions about the Psyches application, like how to run a report or a question on the data you're seeing, we have our psyches-help@omh.ny.gov help desk available Monday through Friday. And we pride ourselves in responding within 1 business day. So you will get a response. And we will do our best to help answer your question. And if you're having issues with your token or logging in, we have our OMH State PC Employee ITS Help Desk you can contact, which is that chat hyperlink there, or the 844 number. Or we have our non-OMH and non-state PC employees, which most of you are as managed care plans. You would use the OMH Help Desk contact information, which is the 474 number and the health help email at the bottom of the screen. So with that, I know we have a minute left. Melanie or Ashma. Are there any questions that came in during today's training?
Michelle, we have a question about the slides and information, if that will be sent to the attendees.
Oh, yes, absolutely. We will be sending the slides and the recording link to everyone within the next day or two, and it'll also be posted to our website.
Great. And then just one final question, and I believe this was related to the recipient search section, but how do we know if a member is Health Home Plus eligible and a restricted recipient for Medicaid?
That's a great question. So we have that Health Home Plus eligible filter. Let me go back just to show it in recipient search. Just give me 1 second and I'm right here. So in the high need population dropdown, we have the Health Home Plus eligible filter, which would show members that you're currently that are currently enrolled or recently disenrolled in your plan that meet Health Home Plus eligibility criteria based on our PSYCKES algorithm, and restricted to Medicaid. So I believe that would be, let's see, the Medicaid enrollment status. You can filter that to, I think, active Medicaid enrollment status. So that would just filter out any other types of statuses that you prefer to not include in your recipient search cohort search for those Health Home Plus eligible individuals. Were there any other questions?
No, those were all of the questions.
Alrighty. Well, thanks everyone. I know we're right at time. Oh gosh, let me go back to this slide. Um, Thank you all so much for joining today's training. And we will be reaching out shortly with that slide deck and recording link. And again, if any other new feature ideas come up, please don't hesitate to reach out to our help desk. Thank you, everyone. Have a wonderful day.